Today, we are diving deep into those liver function tests, or LFTs, that can look so confusing on a lab report. And we get to do this thanks to an amazing presentation put together by Dr. Ashis Mukhopadhya and Dr. Rajan Gupta. All credit to them for the framework of this entire explainer. So chances are you're here because you've got that piece of paper in your hand, right? It's filled with acronyms like ALT, ALP, GGT, and a bunch of numbers. It can feel a little intimidating. But don't worry, by the time we're done here, you're going to have a much better handle on what it all actually means. So let's get into it. Here's how we're going to tackle this. First, we'll talk about what your liver even does. It's pretty incredible. Then we'll look at the tests themselves, almost like a report card. After that, we'll get to the real secret sauce, understanding that it's all about patterns. We'll even walk through a quick example, and then we'll wrap it all up with the most important things to remember. Okay, first things first. Before we can understand the tests, we have to give some serious respect to the liver itself. This thing is an absolute powerhouse. It's not just doing one job. It's like a massive, nonstop factory that's running your body's most critical operations 24/7. I mean, just look at it. It's one of the biggest and, frankly, most complex organs you have. It's juggling literally hundreds of vital tasks every single day to keep you healthy. Now, you can boil all those hundreds of jobs down into three main departments. Think of it this way. First, you've got the protein factory, which builds essential stuff. That's its synthetic function. Then there's the energy regulator, which manages your fuel supply. That's the metabolic function. And finally, you have the purification plant, which cleans your blood. That's detoxification. Just keep these three ideas in your head: the factory, the regulator, and the purifier, because every single weird number on a liver test points to a problem in one of these three areas. So how do we get a status update on these different departments? Well, that's exactly what liver function tests are for. They're like a report card, with each test giving us a little insight into a different part of the liver's whole operation. First up on the report card is ALT. Now, this is an enzyme that pretty much just lives inside liver cells. So if your blood test shows high levels of ALT, it's a really clear sign that those liver cells are getting damaged and are basically leaking. Doctors call this parenchymal injury, which is just a fancy way of saying the main tissue of the liver is getting hurt.
Next, we have ALP. This enzyme hangs out in a liver's plumbing system, the bile ducts. So if ALP is high, it often means there's some kind of blockage or backup in the pipes, something called cholestasis. But here's the twist. ALP is also found in your bones. So if only this number is high, we can't be sure it's the liver. And that brings us to the next test, which is GGT. You can think of GGT as the tiebreaker. It helps us solve the ALP mystery. If both your ALP and your GGT are high, then yep, we know for sure the problem is coming from the liver. But if ALP is high and GGT is totally normal, well, then the doctors start looking somewhere else, usually at the bones. All right, bilirubin. This is the stuff that makes people yellow when they have jaundice. It's basically a waste product that comes from breaking down old red blood cells, and it's the liver's job to grab it, process it, and get it out of the body. So if bilirubin levels are high, it tells us that this waste disposal system isn't working quite right. Now, these next two are maybe the most important of all, because they tell us how well the liver is actually working. They measure that protein factory function we talked about. Albumin and prothrombin time, or PT, are crucial. Low albumin usually points to a more chronic, long-term problem. But a prothrombin time that's going up, that's a red flag. It's an urgent sign that the liver's ability to function is failing right now. Okay, so we've met all the individual players on the report card. Now for the single most important rule of this whole game. You cannot look at these numbers by themselves. It is all about how they look together. This right here is the absolute key. A good doctor isn't just looking at one high number in a panic. They're taking a step back and looking for the overall pattern. Trying to interpret each number in a vacuum is the biggest mistake you can make. It's like trying to understand a book by reading only one word. And really, there are two main patterns to look for. On one side, you have the hepatitic pattern. That's when the ALT is the highest number by far. This tells you the damage is happening directly to the liver cells themselves. On the other side, you have the cholestatic pattern. Here, the ALP is the star of the show, which suggests the problem isn't the cells, but a blockage in the plumbing. Just figuring out which of these two patterns you're looking at makes a massive difference. All right, that's enough theory. Let's see how this pattern recognition thing actually works when the rubber hits the road.
We'll look at a really simple case and see how the pattern tells us the whole story.
So picture this. A 25-year-old guy gets his blood work back, and the first thing we notice is his bilirubin. It's a little high at 34. Okay, interesting. But then, and this is the crucial part, we look at the rest of the report. His ALT is normal. His ALP is normal. So the liver cells themselves seem fine and the plumbing seems fine.
So what's the pattern? It's an isolated high bilirubin. Everything else is fine. The first question a doctor will ask is his body just breaking down too many red blood cells, which is flooding the system with bilirubin? That's a process called hemolysis. So they run a quick hemoglobin test to check. But nope, his hemoglobin is normal. So that leads them to the most likely diagnosis, something called Gilbert syndrome. It's just a common, totally harmless genetic quirk that makes it a little harder for the liver to process bilirubin. Nothing to worry about, no treatment needed. See, the pattern gave us the answer, not the single number.
Okay, so let's pull all of this together. As we wrap up, I want to leave you with a few core principles that you can always come back to when you're looking at these tests. Here are the big takeaways. Number 1, and I can't say this enough, always look for the pattern, not the individual number. 2, keep a close eye on those factory tests. A rising PT or falling albumin are serious signs that the liver is struggling. 3, remember that not every weird number is from the liver. That high ALP could be coming from bone. 4, context is everything. The numbers are just one piece of your whole health puzzle. And finally, number 5, know the real emergencies. If someone is jaundiced and they're becoming sleepy or confused, that's a 911 situation. Get help right away. So the next time you get that lab report, try not to just see a jumble of letters and numbers. Instead, see them as clues. Because your liver tests aren't just data points, they are the opening lines to a really important story about your health. And now you know a little more about how to read it.